Hello everyone, today we are going to talk about esophageal cancer. Do you know someone who has dysphagia and a significant decrease in their weight? Esophageal cancer develops when cancer cells form in the esophagus, a tube-like tissue that extends from your throat to your stomach. Food travels from the mouth to the stomach via the esophagus. Esophageal cancer may have no obvious symptoms in its early stages. As the tumor grows, it narrows the opening of the esophagus, making swallowing difficult and/or painful. During this video, we will explain to you everything related to esophageal cancer, including its causes, symptoms, and how to diagnose and treat it. So our role today is to answer most of your questions regarding esophageal cancer. Today we have Dr. Choi, who is leading doctor at Bundang Jeseang Hospital. He's going to discuss with us everything about esophageal cancer from an experienced medical point of view. Hi, I'm Umay. Before we start, please subscribe to our channel so the next time you'll be updated with our new releases. Good afternoon, Dr. Choi. Nice to meet you. Can you please present yourself?
Hello, I am Dr. Choi, a cardiothoracic surgeon at the Bundang Jeseang Hospital. Nice to meet you.
All right. Dr. Choi, what is esophageal cancer?
Before I explain esophageal cancer, let me tell you about the esophagus first. I've brought a simple drawing of the esophagus. The esophagus refers to the passage connecting the mouth and the stomach. And cancer that arises in this passage is called esophageal cancer. Cancer that forms here, in the stomach, would be stomach cancer. Cancer in the large intestines is called colon cancer, and so on. So if the cancer is localized in the esophagus, we call it esophageal cancer.
Doctor, so what are the first signs of this kind of cancer?
Since the primary function of the esophagus is as a passage that transports food from the mouth to the stomach, the first symptoms to show would be related to this function. For example, think of it as a tunnel. When a tumor grows in the tunnel, the food bolus will get impinged during passage. First, one experiences a hard time swallowing solid food, and if the mass grows bigger, the patient will not be able to drink fluids. That's when people realize that something is wrong and come to the hospital, but most don't present with a specific symptom. They start to notice them once the cancer has progressed significantly, so the patients we see at the hospital usually come at a progressed stage.
All right, so when the patient comes, what kind of examinations are needed for diagnosis?
Since their chief complaint is dysphagia, the exam of choice is a stomach or esophageal endoscopy, where we look for any visible mass. If we see such a mass, a tissue biopsy is performed through the biopsy. We can diagnose esophageal cancer. This endoscopy is the simplest method of diagnosis.
I saw it in the picture, but can you explain more about the stages of this cancer?
Yeah.
When we stage a cancer, as it is with all cancers, there are three criteria: the size, lymph node, metastasis, and if it has spread to another organ. We call this TNM staging. Tumor size, lymph node, and metastasis. Almost all cancers are staged using this method. What are its dimensions in centimeters? Whether the adjacent lymph nodes have cancer cells, and if the cancer has spread to organs such as the liver, lungs, brain, etc. The stages are divided from 1 to 4, according to these three parameters.
And how about the surgeries performed in this case, in this cancer?
It is most desirable to perform resection when it is still able to do so. As I mentioned before, there are stages 1 to 4, and in the case of early stage cancers, 1 and 2, surgery can be a curative treatment option. But once it reaches stages 3 or 4, there are instances when surgery is not a viable option, or we have to resort to chemotherapy or radiation therapy, even with surgery. So generally speaking, surgery is chosen mostly in the early stages. The goal of surgery is to resect the tumor. Therefore, surgery includes resecting the esophagus. Let me explain the procedures in detail. This here is the esophagus, as I've pointed out, which means the cancer is located somewhere along here, which we now have to resect. But once we have resected the esophagus, the food can't reach the stomach, right? So we have to create a separate passageway. But with what? there isn't yet an artificial esophagus that we can use. In this case, we have to pull the stomach located in the abdomen and stitch it up here to make the passage. So the stomach comes all the way up to the chest. This picture on the left shows a stretched stomach connected to the remaining part of the esophagus. This is how a standard esophageal surgery looks like.
Okay. So other than surgeries, are there any other treatments?
As I mentioned before, surgery is a treatment of choice in initial stages. In stages 3 and 4, when it is inoperable, as is with other cancers, we are only left with chemotherapy and radiation therapy.
So after the surgery, how often should the patient come to get checkups?
Some with all cancers, even early stage cancers, have been successfully resected. Doesn't guarantee a perfectly curative state where it never reoccurs. Lung cancer can reoccur, for example, and frankly, any other cancer too. Esophageal cancer is not an exception. We have to check for reoccurrence once we resect the esophagus and connect the stomach to the remaining part. A recurrent cancer can appear on the anastomosis site or completely elsewhere in the stomach, which is why the endoscopy every 6 months to look for signs of reoccurrence and also if there is any sign of stenosis on the site of anastomosis. If it becomes too narrow, one may have a hard time passing food. We have to check for that. So an endoscopy every 6 months would be recommended. And also a CT scan to check for de novo lesions in other organs, such as the lung.
All right. So what is the likelihood of recurrence of this cancer?
Quite low, actually. The reason being surgery is performed mostly in the early stages. For instance, stage 1, esophageal cancer. The 5-year survival rate of stage 1 esophageal cancer, we call it. We count how many stage 1 patients survive 5 years after the surgery. Now, the number may sound good or bad depending on the person, even in an early stage. It is less than 50%. So the prognosis is bad compared to other cancers.
Okay. So is the hereditary or the heredity factor also affects the occurrence of this cancer?
I don't think it would help if I state a specific percentage. Let me put it this way. All cancers have a certain hereditary etiology. Thus, if the parents or relatives have esophageal cancer, we would have to pay extra attention and perform more endoscopies than otherwise. And they also have to try and avoid known carcinogens such as alcohol and tobacco.
So after this surgery, or after esophageal cancer surgery, is there a lifestyle that should be followed, or we can just go ahead and live a normal lifestyle?
After esophageal surgery, you have to pay more attention to your eating habits because before surgery, the stomach is located in the abdomen, and it used to be able to expand after food consumption. But since the stomach is now in our chest, within the chest we have our heart and lungs to each side. So if the stomach expands as it used to, the lungs and heart could become compressed. In addition, there is a risk for reflux when you consume too much, so you have to eat less. And in multiple small portions, for example, divide it into 6 meals a day instead of 3, and to not lie down immediately after eating, in case of reflux and vomiting. So try to work out lightly right after eating, to aid in downing food through gravity, those types of things. Other than these, there aren't big differences prior to surgery in our daily lives.
How about alcohol and smoking?
An absolute no. It is harmful in all cancers, not only esophageal cancer. If you drink after surgery and smoke, the reoccurrence is much higher, and even in individuals without genetic risks, have an increased chance of reoccurrence.
So last question, what can you say to our viewers who wants to prevent this kind of cancer?
Avoid any risk factors to esophageal cancer, alcohol, tobacco, etc. And in the case of Korea, the healthcare system provides a regular endoscopy program for people in their 40s and 50s. So I would recommend people who reach their 40s to go and have an endoscopy every 1 or 2 years, since it's not a complicated procedure, and this can raise the chances of early diagnosis. A successful surgery following early diagnosis can ensure a healthy life. As I mentioned before, once you're having symptoms, it's late. So try to receive frequent checkups before you develop symptoms to allow early diagnosis and try to avoid tobacco and alcohol. Exercise regularly. This would help in enjoying a life away from the risks of cancer.
알겠습니다. Thank you so much, Dr. Choi.
네, 감사합니다.
Today, the doctor explained in details everything related to esophageal cancer, including its symptoms, types, as well as diagnosis and management. Thank you for joining us once again today at Cloud Hospital TV. If you have any questions or comments, please leave them below and we'll respond to you as soon as possible.